Brooke had a spirit about her that we were drawn to her. And
she had a caring for people that, you know, it was magical.
I knew I was not doing well. I had a few weeks to maybe a month to live. I did not think I was going to live.
when I went with Brooke to get her license, she didn't even hesitate. It was an automatic yes.
We know it was something she would have wanted to do.
We spent a lot of time during the case communicating with the families, supporting the families, updating the families. 24 to 48 hours can be an extremely long time for someone whose loved one is laying in a hospital bed and they can't see everything that's going on behind the scenes. Hey Diane, it's Ronnie with UW Organ and Tissue Donation. When I call the nurse and I ask them what's going on with the potential donor, and she will relate to me some really pertinent clinical information. What I will do is I will log into their electronic medical record that we have remote access to, and then I'll call the medical director to establish eligibility for that patient.
My role when I get to the hospital is connecting with the staff that have been taking care of the donor patient. The reason that we huddle with the entire medical staff before we go in and talk to a family is to make sure that we're all on the same page. So we want to find out from the physician what information has been shared with the family. How are they handling the news of the prognosis? Do they understand brain death or understand that their loved one is not going to be able to recover from the injuries?
That person there is not just a body full of organs, it's really a person. It's a patient, it's a very important thing, and it's very important to coordinate with other people who can also address the needs of the family and address the needs of that patient and their comfort, and at the same time optimize the organ donation process. Unfortunately,
their loved one is not going to survive the injury that they've sustained. And so what we want to do is give them an opportunity to make something more out of that through helping others through donation. And the reason that we can feel so confident going in and talking about that is because we have had donor families come back to us on a regular basis and say, you know, donation didn't just save the lives of the recipients, it saved my life.
When people ask us all the time how we work in this job and how we do this, I say, I don't make the painful or awful, tragic things happen. I try and make them as good as they can be, as stress-free, as calm, as respectful, and try to make something good come out of something that was really tragic and awful for somebody. It's very fulfilling, it's very rewarding work. You can see people, you change lives with the gifts that these donor families give.
Our surgical recovery coordinator is responsible for the preparation and eventually the packaging of the organ. I'm thinking about the donor family, the potential recipients the entire time. Once we arrive to the lab, all of our baggage is pre-packed. We could technically leave at a moment's notice at any point in time during the day or night.
It's a little bit of a spiritual experience because we both think we're very excited by the patient who's going to get that organ, and that family is so excited, but at the same time we know how much suffering is from the donor family.
We do this thing called a moment of silence where we encourage the family to give us some information about their loved ones so that we can pass it along in the operating room just prior to beginning the recovery procedure, to let everybody know that this is a meaningful event for the family and that they care about these transplant outcomes.
Most rewarding is getting a great organ, a new and a beautiful organ, I would say, that we bring back to our recipient who is going to live longer.
In order for the successful transplant to happen, there really is probably more than 100 or 200 steps that everything needs to go well. So I usually try not to involve in the emotional side, really try to put everything away and kind of focus on the surgery itself. when I see the transplant patients after the surgery, of course, I don't see one person, but I feel like two persons.
After I had this heart in me, Brooke's heart, the doctors asked me, how did I feel? I go, like I can breathe. I can breathe again. Wow, a simple thing like that.
To give the life to someone else with an organ, and especially the heart. And there's no doubt in my mind that Brooke would be, she would be extremely pleased about that.
What donation does for families who are wrapped in that tragedy, the worst day of their lives, what donation gives to them is priceless. It gives them hope too.
When it comes to donor families, it never ceases to amaze me the strength that they have beyond losing their loved ones. So the strength that they have to make this decision in such a terrible, terrible time. But then beyond that, to take it upon themselves to decide that this was their life's mission, to make sure that the rest of the world knows how important organ tissue and eye donation is. I can't meet a donor family and not be in awe, because they are just so, oh man, they're just so strong.